have been working their entire lives to compete, but without the risk of super spreader events.
Understood. Okay, Dr. Wen, stand by, because I do have other questions for you. But first, back here at home in the U.S., 24 states are now seeing at least a 10% uptick in new COVID infections, this just in the last week. Why? Well, it's the spread of this more contagious Delta variant. This morning, a new analysis by Georgetown University researchers has identified 5 particular clusters in the U.S., mainly in the South, and not incoincidentally with rates of unvaccinated people, that is, low rates of vaccination. Experts warn those areas could become a breeding ground for more deadly variants and sadly put the entire U.S. at risk at a crucial time. CNN senior medical correspondent Elizabeth Cohen joins me now. So Elizabeth, tell us where these 5 clusters are.
Jim, we know that about half of America is not fully vaccinated. If those folks were spread out evenly around the country, we might be able to protect them. Those of us who are vaccinated might be able to protect them, but that is not the case. They are clustered together, which means they could be very easily spreading this virus to each other because they are clustered together. So Georgetown University has been following the vaccination rollout since December, and they've tracked clusters. Let's take a look at the 5 most significant clusters that they found. As you can see from this map, most of them are in the southeastern United States, actually all of them. They go into southern Missouri, but other than that, it's pretty much the southeast and parts of Texas. This is really a problem. It's a lot of unvaccinated people potentially spreading to each other, and the more the virus spreads, the more likely we are going to get a variant that possibly could be resistant to the vaccine. Let's take a look at the characteristics of these clusters. When you put all those 5 clusters together, that's 15 million people in 5 clusters. The average vaccination rate for the counties in these clusters is 28%. Nationally, it's 48%, so you can see that's a very significant difference. There are some relatively big cities in these clusters, Amarillo, Texas, Montgomery, Alabama, but 92% of the counties have fewer than 100,000 people. So these are relatively small counties for the most part, and I've spoken with public health officers in these counties. It is a challenge, they say, to get people to take the vaccine. Jim?
Goodness, with enormous consequences for those people, for their families, and the people around them.
And for
Elizabeth
us.
Cohen, and for us, and our children who aren't vaccinated yet.
Right.
Thank you, Elizabeth Cohen. Back